Why don't we start? Welcome, everybody. I'm Robert Klitzman. I am a physician on the faculty here in the medical school and in the School of Public Health at Columbia. And I also direct the Masters of Bioethics program here. We have some flyers about that. And we thought we'd organize this session. We're very grateful to the students who put today's activities together, and also to Andrew Sunshine and others who were involved in the post-bac program. Because increasingly, as many of you know, medical schools are using mini-multiple interviews as part of their interview process, in which basically students are asked to talk about ethical issues. So usually, you are given 2 minutes to read and consider a prompt, and we'll be discussing several sample prompts. And then you take 8 minutes to answer the prompt, or you may be given a different amount of time. The length varies by each organization or school. And at heart, I would argue, these are all issues that involve bioethics. And bioethics, as we'll talk about, is the field that looks at the ethical, legal, and social implications of advances in healthcare, biotechnology, a lot of the values questions of when do you pull the plug on people, if we only have so many ICU beds, who should get them? If we only have so many doses of an Ebola vaccine, who should get them? What should we tell to women who may be pregnant who live in an area in which there may be Zika virus? Should we say no pregnant women are allowed in the area? How do we deal with this as a public health emergency? And I'm thrilled to be joined today by two of our faculty in our program, Arthur Kuflik, who teaches our philosophy of bioethics class, and Barbara Rothschild, who teaches our clinical ethics class. And we thought we'd have this as a somewhat informal session. We're going to talk about several cases that come up on the MMI, and importantly, how to think about them. How many people here have ever taken a bioethics class? How many have not? Okay, all right. So that's typical. So so we're going to try to fill you in a little bit on some of the things you need to know. And I should say we also have a lot of free information about bioethics on our website that you are welcome to look at. We also have online classes you could take if you're interested, et cetera. Okay, so here's a sample question that you'll be given on the MMI. So now you've been accepted to have an interview, or to change the language, you've been invited to come interview at the medical school, and you're given several stations, and here's the first prompt. You're a physician who has finished his or her day and decide it's appropriate to leave on time for the first time in months. You have promised to meet your family for dinner. You suddenly receive a phone call from Mrs. Green, an 87-year-old patient who has been in a nursing home a long time, who wishes that you attend to her long-standing condition. She has been a patient of yours for 15 years and refuses to see another doctor. What issues are involved? How would you approach the situation? What would you ultimately decide to do? Okay, who has an answer for that? Who's not sure? Who doesn't want to say what they think? Okay,
Bob,
all right.
Bob,
So,
can I ask them a question really
yes,
quick?
please.
Okay, so I used to interview for the University of North Carolina at Chapel Hill Medical School, and we did not use an MMI. So what I want to ask you is, why do you think medical schools might use this as a question for you all, as a way as part of the admissions criteria? So what are your thoughts? Why turn to this as a admissions thing, instead of me saying during my interview, what's your favorite book? Yeah.
Because it points to dual loyalties somebody might feel between their work life and their private life.
So we should just repeat the question. So,
Yeah. Oh no, it points to dual things between their private and private life. So excellent. So right. So they might ask you what your thoughts are on that. Why else go to this type of questioning? Yes.
You get like a sense of how a person thinks like on their feet, and like a very good sense of their moral compass and how they make decisions.
Okay, great. So this young lady said how people think on their feet and a sense of their moral compass. So anybody else with a reason why? Yes, up there.
Just like to tell your reasoning abilities. They may not be a perfectly right answer, but just to see how you reason through a situation.
Okay, excellent. So I think all these questions sort of, when you're thinking about what Bob asked you, what's the answer to this? Those are the kinds of things you need to be thinking about. That's what they want to know, right? They don't want to know what's the right answer, because the right answer is a combination of thoughts, and Arthur can speak to this even better than I can. But what they want to know is, how do you reason? What's your moral compass? How are you going to go through this? Even, can you identify, as the first gentleman said, what the issues are? Can you immediately start to sense, like, why is this even a problem? Why is somebody even asking me about this? So when you're thinking about these questions, it's sometimes helpful to think, okay, what's this about in the first place? Why are we going through this exercise? Right. And once you've done that, then you can start to go back to the question and think, what do I need to tell the medical school about me through my answer to this question? So, sorry, Bob.
Yes,
I just thought it might
great.
be better to frame it that way, yeah.
Can I jump in?
Yes,
Jim?
please.
So,
Please speak in the mic.
I want to, yes, thank you. So I think I completely agree with Barbara that they're more interested in how you go about discussing this than what exactly is, quote, the answer. And in this regard, I think sometimes these tricky scenarios are a little bit underdescribed. It might be good for you to ask some questions yourself. Well, how critical is the situation with this elderly person? Is this something which the doctor could speak to her over the phone, comfort her, and say, I'll see you tomorrow? It says this is the first time in a long time he was planning to be with his family on time. Has he been, extending himself or herself so much? But maybe in less critical situations, maybe this is the one where he or she should, in fact, call them up and say, can I see you? Let's have dinner, but an hour later. No, sometimes the situation seems very confusing because actually one would like to know more information. One would like to have it more fully specified. But I do think they're obviously looking for, what sorts of facts would you want to ascertain? How would human beings be impacted or affected? Do you have some empathy for your family, which has been waiting to have a nice dinner with you for the longest time? But this elderly lady, is she just a little bit, needy emotionally, but you could handle that by phone? There's no real pressing need to be there this moment? Or is this the one time where something critical that she needs, she refuses to have anybody examine her or help her out, except you, because you have this long, I think it might show a great deal of moral perceptivity on your part before you give away what you think might be the answer, just to sort of ask some further questions about the scenario. So I think I give that as a sort of general all-purpose strategy. If you're wondering and you're a little bit confused, well, is the situation like this or is it like that? Or I would like to know more about such and such. Might be a very helpful, not by way of belligerently putting them on the defensive, but by way of showing that you are very thoughtful about all that could be at stake. So that's just my 2 cents.
Yeah, that's great. And I think the way to frame that is, as Arthur said at the end, to say, well, some things I'd want to know are, because probably the person's, if you say, well, where's her family? The guy's not going to tell you an answer, right? So what you need to say is, some things I might ask are, where's her family?
Right.
It's, what is her condition?
What is her condition?
Et cetera, et cetera. So just to show that you're thinking about very logically, in a big way, that you can abstractly think about it, reason well, et cetera.
Also, I might say just one last thing. Sometimes, not always, you can't always slip out of the predicament with a compromise, but sometimes it's a little artificial to think it's either or. Either I ignore her and meet my family, or I meet my, or I go to where she is and I ignore my family. Try to resist some kind of, pulling you to one extreme or the other, if it's feasible to talk about something more modulated. It's not a perfect situation. This may be somebody who needs more than just you to pop over there this particular time. She needs more emotional support in her predicament. But then again, you need to protect your own personal life. There are areas of medicine, I'll defer to Dr. Rothschild, where it's part of the job, like a firefighter, to take great risks, at any time. So, that they may be looking for that too, that you're sensitive to some areas of medicine. It comes with the territory, that you do sacrifice a little more of yourself, or else you pick a different specialty from that one. So, at any rate, I've got 2 doctors here, so I'm going to defer to them.
No. But I think those are right, and those are riffing, if you will, on the question you asked about, the point you made about dual loyalties. So I think when you say, well, there are dual loyalties here, and then you could say, what that means, and ethically how you'd frame that is, what are my responsibilities as a physician? What are the rights that a patient has? What are my responsibilities to my family? What are my responsibilities to my work, et cetera? So I'm going to just mention this and then go on to sort of some conceptual framework, but please jump in if you want. So here's another actual question. Due to the shortage of physicians in rural communities, it has been suggested that medical programs preferentially admit students who are willing to commit to a 2 or 3 year tenure in an underserved area upon graduation, that is from med school. Consider the broad implications of this policy for health and healthcare costs. For example, do you think the approach will be effective? Thoughts? Yes.
Well, I think that the idea behind it is good, but if you're looking for quality healthcare in rural areas, probably having people who are mostly students perform the work is not going to be as effective as setting up a fund for somebody perhaps more experienced in those areas. Something like how school teachers in rural areas are less, like, fairly underpaid, therefore they aren't getting the quality instruction that is needed in those areas.
Right. So in other words, there may be costs involved, there may be disadvantages and disadvantages, benefits and costs. Here are some of the disadvantages of this, okay? Other thoughts? Yes.
I think an advantage might be that if it's an underserved population, perhaps they don't get the kind of access to healthcare that some other folks who do have. Like they see a doctor regularly, so they might be they might be like less healthy than some other individuals, and this might be a good opportunity to learn from patients who are, don't keep up with their meds or don't take or not prescribed the kind of medication they should be. So this could be an opportunity to learn for a graduate.
Okay.
Patients who are not very healthy.
All right, so there are advantages, there are disadvantages, there are advantages, yeah?
I feel like it might be setting up, if you're only saying 2 to 3 years, if you're not getting physicians who are creating long-term relationships, like you would never have a 15-year, like, running for 5 years. You have only like for 2 to 3 years, and I wouldn't even have a
Right.
and that long-term patient interaction could prove beneficial.
Okay, so 2, 3 years is short. So what you're getting at here is you're expanding the questions. One question is, should a program, what are the disadvantages and advantages of a program like this, and are there ways it could be improved, right? Should there be such a program? How should there be such a program? Maybe it needs to be longer periods of time, maybe shorter periods of time. Other thoughts? Yes.
It can screen for people who would be most enthusiastic to serve in those settings. Because perhaps someone in graduating medical school would actually be really interested in going to a certain geographic region, but might not know how to get there.
Okay.
How to find work there. So it could actually attract people who really do want to be there, and this is a way to start that time.
Great. So there are questions about which patients would you see there, and then which doctors may be best. So maybe it's not all doctors, maybe it's some doctors, this is really their thing. Okay? So again, there are ways to, it's not only is it black or white, good, bad, but how might it be structured to make it more effective, et cetera. Any comments at the moment, or?
Well, I mean, one thing when I read this case as I was thinking, and again, I think as a pure cold strategy to get you into medical school, remember, you don't have, like we said earlier, you don't have to have the answer, you just need to talk about the elements of the problem and what you think about, and pick up on the elements. And I think the more you can think out a little bit outside the box on what those elements are, the more impressive you come across. So there's the things that are obvious, and then there's some other things. Like, for instance, in this one, preferentially admit students. So wouldn't that mean that maybe not the best students are admitted, right? So maybe not the smartest or the brightest, and what do we want in our healthcare system or from our doctors? Do we want the people who make the best scores? This gets to a larger question. Do we want the people with the best grades, or do we want the people who are going to serve the community, right? So that's an interesting question that comes up in this case as well. How does it reflect overall in how our healthcare, what doctors look like or who they are, and where should we put where are our values in that world? Are there other ways, should we be paying back loans for people who decide to do this? Is there something other than this sort of preferential admission system that might get your goals done better? So these would be, now granted, you're like you have 2 minutes to think about this, so I'm not saying that you can go up with everything, but sort of thinking, looking carefully, reading the question carefully, like that little thing about preferentially admit, that should give you a little ding, ding, ding. I should look at that a little carefully, because that's a little different, right? That's not how we do it now. So let me sort of speak to that and how that really would change the way things look. Because I think it asks at the end there, it says broad implications of this policy for health and healthcare costs. So anyway, so that's just another sort of couple of hints about how to read these questions.
Right. And of course, unfortunately, this is probably not the question you're going to be asked, but,
There'll be one slide. This
but
is
it's a very good example.
Yeah, yeah.
It's a very good
Right.
example one. So following up on Dr. Rothschild's comments, I think, again, one might ask is, well, what other options are there for making sure that these underserved communities get served? For example, it's been suggested that there be something like a medical version of the Peace Corps, where you actually get your whole medical tuition paid for in return for a certain amount of time serving there. Now, this question of, well, who's really motivated to serve there, is a good question, and I think it could come up either way. Somebody so eager to go to medical school and get in might say, okay, I'll serve in that community, even though it's not really where their heart is. Or somebody, eager to, have the heavy debt waived in their case. I don't know how we can sort that out, except maybe in an interview about that particular issue. Why are you so interested in serving in an underserved community? But as for whether you would settle for a lesser quality of person, I think something you could ask is, well, is it the case, as I think I've heard, that many more really qualified people apply than can be admitted? So there would be no need to go below, no need to say, well, if we give preferential treatment, well, it's among those who are already highly qualified that we're just going to give a preference. We're not going to go down below that baseline. That might be a thing to ask them about, or to show that you're thinking about that. Again, it's under the broad strategy of, do I have to swallow what they seem to be suggesting whole, or can I say, well, are there alternatives? Is it that way? I'd like to see some empirical data about what happens in some other countries where they do this or that. I believe in France, the medical education is paid for entirely by the state. So it's not, and that's a highly rated medical healthcare delivery system, so some people think. So it's not out of the question that we could even go that far. But again, you might say, I'm a little concerned that we not take anybody underqualified. These communities deserve only the truly qualified people, but those who are motivated to serve them at the same time. That sort of thing where you, reaffirming what Dr. Rothschild was saying, that it's the process you're able to, on your feet go through that should impress them that you are a thoughtful, empathetic person who also wants to know more about the facts before you, jump to a conclusion.
It may be obvious, but then I think, having interviewed people, and I thought it was obvious, but clearly it wasn't for some people. You don't answer this question was, that's a really bad idea, or that's a really good idea. Like, even if you personally think that, remember going back to why they're asking you in the first place. It's not about your personal opinion. It's about how you think about the question. And it's not to say that you can't say, I think, for me personally, my values would suggest this. But it's acknowledging other people's values as well, or saying, other people would think this, and I understand that, but, I think it's more important that this value system be followed. That's okay, too. Medicine is becoming so much more of a teamwork process that medical schools, I think, are really looking for people who aren't going to cause, enormous amounts of interpersonal problems. And so one way to know that is that people who can acknowledge other people, still have their own perspective, feel strong in their own value system, but not be overwhelming about it or so black and white about things that they're cutting off other ideas. So these are all things that when you think about what makes a good doctor, it's all coming out in the answer to your question to this, and reflecting how you're going to work in a team, how you're going to be as an individual, are you going to stick to your values? All this is a way to show them those things, because every single person comes into the interview and says, like, I can't wait to be a great doctor, and I'm gonna save people, and I just really want to work with people, and then now we have all these complaints about doctor-patient relationships, so something happened. So it just, these are the things to keep in mind.
So you're saying it's not a good idea to blurt out, that's a bad idea.
Right. I don't think
you want to show yourself thoughtfully open to exploring it.
Yes.
And, only in an extreme case. So, I usually like to consider alternatives that I hadn't thought of before, but my initial impression is that this is not so good for the following reasons.
Yes.
But do you have any thoughts about why it might be good? I mean, if you can't resist saying that I think this is not a really good idea, at least have some reasons, and also maybe ask the question. Is there another side to this that I need to think about?
Or in this case, if you thought this was a bad idea, at least acknowledge the problem exists. Like, I understand that there is a problem getting quality doctors to rural areas. I don't think this is the way to go. Mm-hmm. That's okay, because then you've acknowledged the problem, but you just don't agree with this particular thing. Mm-hmm. But I think these are all ways to sort of show yourself as someone who is thoughtful, who's able to think about other perspectives, but still stick to your guns and know your own values. So.
I think if you start out saying for most of these ethical issues, well, it's complicated, you'll be acknowledging a lot of the reality of what's involved. Okay, so any questions so far or thoughts?
Over here.
Yes.
So, as we're going along, I just keep thinking about the time limits that you're given.
Yeah.
And now that you bring up that, it is okay to kind of clarify the question and try to really understand how you want to answer it. Does that take out of your time? Like, when does the time?
So, right. So when does a time start and end? So normally, a lot of places, it varies from institution to institution, but usually say it's about 10 minutes. Often there'll be maybe 6 or 8 stations. You go to each one. It'll say on the doors a prompt. Here, it'll say this, literally, take 2 minutes, then come in and talk about it for 8 minutes. And they'll give you a sense of time, usually. Where's Limmery? Do you want to comment on how do they give you a 1 minute, or what? How is it working these days?
As you mentioned, it does vary from institution to institution, but generally speaking, you will be given more or less 2 minutes to review the prompt, and once you go in, the expectation is you're ready to hit the ground running, and you'll maybe have 6 to 8 minutes. They'll tell you beforehand, okay? So they'll tell you beforehand in terms of how much time you have, and they operate differently, whether the bell goes off or if someone comes and gets you.
Right.
But Bob, we should clarify that when we say you should ask more questions
Yes,
about the
they're
problem,
not going to answer them.
They're not going to answer them. It's not that you're saying, wait, do I need to answer this part, or
Right.
can you give me more information about it? It's not really. It's more your rhetorical questions.
Yes.
I would want to know.
I would want to know.
Right.
Blah, blah, blah.
I think we would need to find out more about such and such.
Right.
It should be because,
Right,
and say
exactly.
why. Why is that relevant?
They're going to say nothing to you except at the end of 8 minutes they'll say time's up.
Right.
All right, so
But
that's
you do have those 2 minutes to kind of ponder it and say, well, why is this kind of challenging? What makes this a
Right.
challenge? Is there some information that they're really not telling us, and that a thoughtful person would want to make sure we get that information? Is it a trick here that I need to show that I can empathize with? I can imaginably understand how some people might be feeling here, and not just callously, ignore them. I think those are the elements, really. Your attentiveness to what information is needed, what emotional understanding is needed, as well as, some of these bigger ideas about, well, doctors have their personal lives, but they have their professional responsibilities. There's sometimes not enough resources. I think we're going to be making, we have other scenarios, but not enough resources to serve everybody. That is a complicated question, how to prioritize. So go ahead, doctor. I don't want to.
There's
Yes.
another question.
Yeah, sorry.
yes. Yes, correct? Yes, you could jot down things.
She's sort of iffy answer over. Is that right?
They'll give you the parameters beforehand. I know for us in the post-bac program, we conduct mock interviews for some of our students who are pursuing schools that require the format, and we prefer they don't take this. It's good practice to organize.
Yeah. So I think if it were me, I would recommend for the 2 minutes you do take notes. So you realize that, just at least a few major points, bullet points you want to hit. Like what are the costs, what are the benefits, to whom, what would I do if I was a student, or the alternative, something like that. But in a moment, we'll go through sort of structured questions to ask. Yes?
8 minutes is a really long time to talk. Would it reflect poorly if we thought we could answer the question in like 5 minutes and just
The answer is yes, it would reflect poorly. I would think if I was in an interview, given these are all very complex questions, 8 minutes will pass more quickly than you think. If you look at your average phone call to a friend, but I would also recommend you practice, and we're setting up some practice things too, but you'll see these are you could write a 20-page paper on any one of these, sort of unpacking it. So I think I would plan to use the full time. Yes?
Is it also bad if, like, they say time's up and you're still talking? Like, should you try to hit it exactly 8 minutes?
I would, if they say time's up, I wouldn't say, oh, no, I have a few more things to say, because they have people waiting. I would just say, finish your sentence, and then say thank you. And you could say, there's some other points, but I see our time's up. So I'd be very respectful of the time limit.
Graciously and respectfully.
Yes, right.
It's been proposed that the purpose of these types of questions are to display your reasoning abilities, and that it's not so much about the conclusion or a specific answer. Might interviewees be looking to make sure that you have the ability to come to some sort of conclusion, even when confronting a very complex scenario, and therefore, should we actually draw a conclusion, not just,
So I wouldn't, in a moment, I'm going to talk about some sort of overarching structural issues. I think it depends what you mean by conclusion. I think you could say in the end, I think this depends on, what the relationship is with the woman. I think in the end, there are several questions I would have. My conclusion is that there are several key things I would need to know. Or my conclusion is that it would be great to have research also that tells us, which students do stay on for more than 3 years, or something like that. So it wouldn't be, in the end, if I was President Obama, I would get rid of this law. I mean, if you feel that way, you could say that, but I think a conclusion would be sort of, if you were to summarize your thought, I think more a summary than an answer.
I see what you're saying, but I guess what I'm asking is that I could see that someone might see that, summarization of the issues as like somewhat of a cop-out. They might want you to make a judgment. Like they want you to weigh the issues and be able to come to some sort of judgment.
Yes. So again, there's no clear right and wrong. I mean, some may say, we'll give feedback along the way, potentially, yes? I mean, an interviewer may say, well, thank you, but we have a few minutes left. What would you conclude? Or what would be your judgment? So I think you want to be open, but I would be prepared. I think the key thing is that you were able to think through some of the complexities and show that you can reason, and I'm going to come in a moment to some of the basic principles you want to touch on. So,
Yeah, but I'd just be a little hesitant just because it can come across as hubris in a way, or as you're not a doctor, right, yet. And so to say, I definitely would, go to see Mrs. Green because, I mean, I think that you see what I mean? Like, it can come across a little before your time,
yes, right.
sort of thing,
But also premature,
careful.
yeah, also premature given what Arthur said. For none of these scenarios, for most of the scenarios, you will not have enough information to make a full decision. It's sort of like a clinical case. A man comes in, 80 years old, collapses on the floor, blood comes out of his mouth. What would you do? Well, I would definitely do
I
that.
know what he's got.
I mean, you don't want to say, well, of course he must have, whatever it is. I mean, you'd want to think through, well, I'd want to get his medical history, I'd want to check his pulse, whatever it is. You'd want to, it's more the thinking through rather than the answer is not really what counts, it's how you get there.
But to
by
say
and
I'd
large.
protect his airway and check, I mean, those were things you'd absolutely do, right? It's just not to say, but I know what he's got. Like, you can say some things that you know that even a reasonable person can say as a judgment. I think I think Dr. Kuflik's very good at expressing this, and Dr. Klitzman, but that you just want to not, though, be so sure of yourself that you've come across as someone who's saying something beyond your knowledge.
So my 2 cents, if it's a policy issue like this one, we have to remember that when a policy will have some advantages and almost always have some disadvantages. Winston Churchill is famous for having said, democracy is the worst form of government except for all the others. In other words, it's not, you show you're sensitive, like, well, I think this policy would have some advantages like the following. There might be a few problems, but I'd like to see what the alternatives are. Because, you can't say it's no good because it has a problem, because we need to know whether the alternatives all have more problems, right? So for anything that's at the public policy level, keep that general idea in mind, that there's undoubtedly, if it's an interesting question, there's going to be some good stuff about it and maybe some potential not so good. But that alone isn't conclusive, so you could even quote the Winston Churchill line if you want, if it's a policy issue. Now, if it's something more, the more individual clinical thing, doctor and patient, it seems to me there are only certain if it's a tricky question, here's what tricks us up. There are a lot of valid, relevant interests to consider. There's a lot going on. That makes it complicated. So you don't just want to say, it's complicated. You want to say, it's kind of complicated because, on the one hand, doctors have a legitimate, interest in not burning out and in having a family life. On the other hand, there's this woman, now I need to know more about just how urgent this is and whether she can be, consoled, and, without, so I think sometimes there's just many dimensions, like in physics, the many-body problem. We know it's gravity, but it's kind of hard to calculate when you've got the forces pulling through so many bodies. So there's the many-body problem, right, very often. And then there's also, I think, the factual uncertainty problem. And there's also it's unusual situation, hardly anybody's ever been in it before. It's hard to imaginatively project ourselves into it. So I think you might do a 30-second diagnosis of why do they think this is a good, tricky question to be asking me? But what you really want to do is what Dr. Rothschild is saying, just show how thoughtful you are, how you're able to try to begin to put the pieces together in some way or another and explain where there are missing pieces. Just that shows you're a morally thoughtful, morally perceptive person. And to do that, you don't actually have to be too dogmatic or, But again, I would agree. If all you ever said is it's complicated, it's kind of hard. I don't really know.
Right.
That obviously is going to make you look like you're just faking it, right?
Right, yeah. I wouldn't just say it's complicated. Okay, so just to give you a little bit more bones about sort of structure, which is sort of crystallizing some of what we've been talking about. So there are various decision-making models out there, sort of a framework. So one is identify the problem. So two is identify the potential issues involved or conflicts, review the relevant ethical principles, know relevant laws and regulations. You may consultation, you may say, well, who else would you want to talk to? I'd be interested in talking to students who've actually been to these rural areas, find out what their experiences are. I'd want to talk to the staff at the nursing home, find out what they think is going on. Consider possible and probable courses of action, list the consequences of the courses of action, and both good and bad, and decide what appears to be the best course of action. So this gets in the conclusion. You may or may not say, it may be that you don't have enough information to make that, but you might say, on the one hand, we might do this, but we'd want to find out this and this first, et cetera. And identifying the problem is to say, well, it seems there's a conflict here. Do I go home? Do I take care of this woman, et cetera? Now, just some bioethical principles. In bioethics, there's 4 key principles that seem very simple but come up in all these. One is autonomy, respecting the rights of individuals, letting people make choices for themselves. If I were to say, I'm now going to lock the door and do an experiment on all of you, that would be wrong, right? We respect people's right to say, well, no, I don't want to be in an experiment. I want to go, have lunch. What's that?
Let me out.
Let me out. And so, for instance, there would be beneficence, doing what's good, what's in the patient's or whomever's best interests. We want to avoid harm, a concept known as non-maleficence, and we want justice. We want to do what's fair. We don't want to say, if you work on the Upper East Side, we're going to pay for your med school, but if you work in a rural area, you're not. Or you may want to say, what's fair? There are people who need health care who don't have it. How can we take care of the underserved? So, for instance, on these examples that we had earlier, the patient on the one hand has a right to have health care, right? She's in the hospital, but, maybe it's not a big problem. Maybe it's a problem she's had before. Maybe a nurse there can have it, et cetera. Beneficence, you don't want to say, well, screw her, it's my night off. You want to be doing good, et cetera. So, but these principles, remember, could be defined in different ways. So even something like justice, we all agree justice is good. Right? There are different definitions. So there are people who say, even with Obamacare, there are Republicans who say, I'm against Obamacare because I think if you put more money in the system, you should get more out. And if you put less money in, you should get less out. That's justice. Other people say, well, no, justice is that everyone deserves a certain amount of health care, even if they can't afford it. That's what's just. Some people say, you know, well, everyone just gets the same. No matter if you need more or less, you're going to get this amount, and if you're really sick, you still get the same amount. So again, each of these may be justice, but we define these terms. They seem very straightforward, but even with rights, how much right does someone have? How much autonomy? We have patients in the hospital all the time. I'm on the hospital ethics committee here. Patient says, well, I'm going to go home now. And doctor says, well, if you go home, you'll die. Well, I don't care. I go home, I'll drop dead, but I'm sick of the hospital, I want to leave now. Who would say, let the patient go home? Who would say, keep the patient against her will? Who's not sure? Okay, right. So there's all these questions of, well, what's wrong with the patient? You know, does she have capacity to make these decisions? Is she psychotic? Is she someone who thinks that, you know, she's really Mother Teresa and that she, whatever, I mean, she may be nuts. So again, there are details that are important. And again, autonomy, whose autonomy? And these are some other kinds of cases that may come up. A sister doesn't want to donate a kidney to a brother for whom she's a match. So who thinks that's fine? We'll just let her. What should we do there?
Well, it depends on how old they are, because if it's someone a lot younger, it might be more of a parental decision versus if it's.
Right. So you want to know what are the ages of the people? What's the situation?
Also, why doesn't she want to donate? Is she scared? Is she
Right. So you want to know the reasons. Exactly right. Yep. Right, so there's lots of considerations, but again, it's not here, it's a matter of it gets to the conflicted loyalties. Both people have certain rights, right? You don't want to say, well, tough, you're going to die, and you don't want to say, well, you have to give a kidney no matter what. You want to find out what's going on, right? I mean, what do they each think? Have they been talked to about it? What are the risks, the benefits? Is there another brother who will give a kidney maybe, et cetera?
Yeah, I just want to, on this notion of autonomy, which is a very complex and subtle notion, you know, there are grades of this, right? What the person has a moment, a temporary impulse to say or to do. Most people don't think that's truly autonomous. They think has to be the person's stable, authentic, informed judgment, right? And so part of the job of the medical personnel, and maybe of other people, a pastoral counselor or a hospital social worker or a psychologist, is to go in there and see, well, you do understand the facts as the medical people have come up with it. If you go home, you really will die. We understand this is difficult to be here, and you may, in fact, all things considered, want to be home, but we want to make sure that you really do understand what's at stake. And so there's a certain amount of, ideally, there's a lot of work to be done to help a person make the most truly free, informed, and self-expressive judgment. As you know, even John Stuart Mill, great champion of the liberty of the individual, said if somebody's trying to cross a bridge to get to the other side, and unbeknownst to that person, the bridge is rickety. There was a sign that says, "Stay away, bridge unsafe," but some malicious, mischievous teenagers took it away. You could rush up to them and say, "Wait, stop, stop. You know, this bridge isn't safe." And they might, "Oh, thank you." Or they might say, "I know that. I'm trying to commit suicide. Please leave me alone." So in other words, part of it is the work at figuring out what is, the person can say something. That doesn't prove it's their own, you know, most settled, most considered, most informed view. And it could be a bit of a hassle to work with somebody who's in an emotionally stressful situation, to get them to be a little more patient about understanding what the parameters are. And it may not be the job of just one person, of the doctor as such. It may be that you need a team of, if you really want to respect people as leaders of their own lives, you may need a team of people. You could throw that idea in too. And whether some people say, we can't afford that. Our system is expensive enough as it is. But autonomy is a tricky notion. It usually doesn't just mean what the person at this moment feels like. It seems to involve going deeper into how free is their opinion here, how informed is it, how authentic is it really for them? Is it something sort of out of character even for themselves because they're scared or they're sick or something is skewing what would be their own most deepest, most stable, most authentic attitude. So all that takes some work, unfortunately, to really live up to the ideal of respecting people as autonomous.
And just to piggyback on that, autonomy of the four, the emphasis on these four principles differ culturally, from
Right.
culture to culture.
Sure.
Even different areas of our own country, you'll
Sure.
see some subtle differences. But to your question up at the top, on this, the sister doesn't want to donate a kidney. I think you would be within your rights to, or it would be reasonable and not come across poorly to say, to give all the issues, to ask all the questions about what are things, but ultimately to say, but in our country we respect autonomy, and there's no circumstance under which we would take this kidney against her will, and that is you're there, like that's fine to make that sort of statement because it's consistent with the ethical standards we.
That's a deal breaker.
Yeah, that's it, right. It's a deal breaker.
They wouldn't just grab her kicking and screaming.
Right, we don't just throw her in the OR and take the kidney because it'll save him.
But we might want to know whether it's because she's uninformedly afraid that she's sure to die if she does this, or some, right? As some of you
Right.
asking, what age is she, what health,
What
there's-
she's scared
a lot
of,
would
all
be-
that's
yeah.
reasonable.
I mean, there was a woman who refused, I guess, a C-section, whereas in fact it was absolutely essential both to her survival and to the survival of the, baby to be, because she had known somebody who died from a C-section. So you don't know to find out what's really going on. It was a man who refused some procedure. It turned out what was really bothering him was he thought that he couldn't be there to help his own daughter with her baby care because the daughter had just gotten a job, and he was the only one who could look after the baby. So he didn't want to be away for 2 weeks or 10 days in the hospital, and they had to say, well, actually, we can arrange for childcare while you're, or something. So there's a lot to sort of explore, and again, you're not asking them for the answer, but you're just saying, well, I would like to know if such further information really needs to be conveyed more vividly, more meaningfully to the person.
Right. So I think what Arthur's suggesting is an underlying principle is to find out why people are saying the things they're doing.
Yeah,
So if
yeah.
if there's a conflict,
Right.
What's going on is partly why are they saying that they do or do want you to come visit or come home or whatever it is. Yes.
This is sort of specific. Is there a body within the hospital that can actually require a person to make a certain choice if it's in the greater interests of both parties? Like, sort of thinking about this, the sister and the kidney and the brother idea. I mean, is there some kind of ethical system set up for
So
the C-section idea?
Right. So every hospital has to have a hospital ethics committee that deals with tough issues. There are also lawyers in the hospital, and sometimes these are legal issues that the hospitals generally don't want to be sued. So if someone says, a woman may say, I don't want heroic measures done for me at the end of life. At the last minute, the long-lost son comes up from California. It's usually a son, and he's usually from California, and says, don't you dare unplug my mother or I will sue your a lot of hospitals think, well, last thing we want is a lawsuit. We'll just keep things going. So there's a bunch of legal implications, and laws vary state to state and nationwide, and there are ethical issues. I mean, you try to mediate an agreement that's good for everyone. Like if you talk to the son and say, what's the issue? He says, I haven't seen my mother in 30 years. I've been a not nice son. I feel really badly. Maybe you could say, well, look, why don't you talk to her, your sisters? I mean, let's try to work something out. So you want to respect people's autonomy. We really try not to, do something against someone's will, generally. Okay. So, and so there are limits to autonomy. The parent of the unborn child, there are cases, someone uses an anonymous sperm donor or egg donor and the kid doesn't know. Does the kid have a right to know? And of course, there are some patients may have Alzheimer's and not be able to answer, and so there are limits. Beneficence, a patient with end-stage cancer wants to be in a trial, but the results will benefit future patients, not him or herself. Right? These are just some of the things, in other words, that even beneficence, there are questions about how much will people benefit, who will be benefit. If the supply of a drug is limited, who should benefit? Whose benefits count the most? So again, there are issues like that can come up. We have a few minutes left, so let me just run through, so a few more slides and we'll open up the discussion. how to weigh competing ethical principles. A patient who wants to refuse treatment but will then die. Should the patient be treated against his or her will? This is autonomy, the patient's right, versus beneficence, who want to do the right thing. So these principles can conflict. A parent doesn't want to vaccinate her child. Okay, topical. This is actually another question that's actually been asked. What would you say? What would you do? Who says vaccinate the child anyway? Who says don't vaccinate the child? Who's not sure? Okay, right. So again, patient's autonomy versus child's benefit. What might you do?
So, and vaccination is, right, so juicy, right, because it's justice too, right, because
Right,
it
yes,
involves all
correct.
of us. So
Right.
this is one where if you got it, you'd be like, sweet. Because, this is one where you can easily, bring out these principles because everybody gets involved in how vaccinations
correct.
work, and that's the way to think about it. Is there a public health measure, issue involved in your question? Because then justice is, that's your key, that probably justice is
Yes, right,
is there.
right.
And then autonomy and beneficence.
So the key thing there, the way to frame that is who is going to be benefited and who's going to be hurt in each of these cases. If the mother vaccinates the child or doesn't vaccinate the child, who are the people benefiting? Who are the people being hurt? Who has rights here? So there's the rights. So what people have rights here?
The mother was supposed to raise her child and her
Right, okay.
culture her way, but also at the same time, the general society, because I think
Right.
anti-vaccine people kind of, I'm not to judge anybody, but I think they kind of go on this principle that, well, I choose not to be vaccinated, but at the same time, they're benefiting from the greater public,
Right,
kids
right,
being vaccinated,
right.
so their child doesn't get sick.
Right.
So that's another issue where the greater public health concern is also very important, because if we don't vaccinate, the more and more
Right,
people
correct.
are vaccinated, the more these diseases come to
Right.
Right. So in pediatrics, know that the state considers itself to have an interest in the child. Okay. So while the parent also is autonomous, but nevertheless, the child generally has another player, and that usually only comes into place when the decision being made is a mortal decision, for instance, something that could kill the child or seriously harm the child, and then the state will step in. Vaccination is one of those cases well, is this really, enough for the state to say I have a stake in this child to vaccinate or not vaccinate when the chance of you actually getting that disease is small. Now, small because we vaccinate, but nevertheless, these are the sorts of things you can bring out.
Well, I think what you're saying is that there's a kind of free rider issue there, that they're relying on the so-called herd immunity. A lot of other people have taken this risk, if you will, and that's why it's safe enough for a few other people not to. There's the factual uncertainty, the people claiming this causes autism. The best medical evidence is that that's just not the case. So parents could have other reasons too, like why are they refusing? But the thing is, it's not, they talk about parental autonomy, but some bioethicists have said it's really parental authority. It's the authority over another human being, a child, which they usually have. There's a presumption in favor of parental discretion over their own children. But obviously all agree to limits. There's abuse, neglect. There's abusive stuff, right? Well, are you abusing the child by not having the child protected in this way? Are you abusing other children by having yet one more human being going around that could be a host for the disease agent to mutate and defeat the vaccination strategy, or just to affect other people, elderly people whose immune systems are weak, infants who are too young to be vaccinated in the first place? There's an other impacting dimension to, I don't want my child vaccinated, that's my decision, it's our life, forget about it. It's not a purely personal self-regarding thing, and it's not a purely autonomy of the adult thing. If a Jehovah's Witness wants to refuse blood transfusion for herself or himself as an adult, fine. But the courts have generally sided with the medical personnel and public health, saying, look, if it's a dire emergency, unless this transfusion is performed, the child will die. And even some Jehovah's Witnesses have come around to that idea that it was against their will, they're not to blame. Certainly the child had no will. The child is sinless, right? Okay, you've transfused my child. There's even ways around that. But I think the vaccination thing is something they might well ask you because it's so current. And you bring out, there's more dimensions to this. Parents usually are allowed some significant prerogative over their children. This may be a different kind of a case because of the these other factors we were just talking about.
There's a question up there.
Yeah.
A great book I read that helps get you thinking about a lot of these kinds of issues. Maybe people have read it. The Spirit Captures You When You Fall Down by Anne Patterson.
Yeah, it's excellent.
Yep.
Yeah, it's great.
Right.
But I think if you're thinking about how to prepare for an interview, this immerses you into
Yep.
an interesting gray area.
So I want to make a few other points, and then
Great suggestion.
two or three other slides, then more discussion. So one approach is a sort of consequentialist, utilitarian approach. We should do whatever is the greatest good for the greatest number that you could mention. Applies in many cases. The number of kidneys or Ebola vaccine doses are limited. Who should get them? But there are limitations. There may be minorities, however you define them, who may be unfairly overruled. There's a rights-based approach that everyone has inherent rights. That should not be violated. This was Immanuel Kant has written about this quite eloquently, a notion of what's called deontology, that there are duties and rights that we all have. Individuals may, for instance, have a right to health care or HIV medication, even if they can't afford it. So it's not a matter of, well, we just don't have enough to go around. They have a right to it because we have certain basic rights. So again, who are relevant stakeholders? What are their respective rights? What are the risks and benefits to each, et cetera? Could there be mediation? And then process considerations. Who else you should speak to? You want a transparent process if that comes up, et cetera. So there may not be one right answer. You want to weigh these different issues. We have a few more minutes.
Well, on that one, I just make a comment. I'm the philosophy person. It doesn't have to be either or either. I mean, there is the combined view, which is we should promote the general welfare, but within the bounds of respect for, in other words, we shouldn't be sacrificing individuals as though they were mere means to the promotion of the general welfare. But provided that certain basic rights are respected, that's what we should be doing from that on, namely doing the best on balance that we can. The two things can be coordinated to some degree, but there might be some tricky cases where somebody's going to hit you with, well, so supposing we treat a few people like mere guinea pigs, but look at all the great benefits, right? And you might want to say, well, I'd like to see a realistic scenario for that, because maybe in the real world it doesn't quite work like that, or something like that. So, but that's a long-standing theme. Does the end always justify the means, or are there some constraints on the means reflecting respect for each person's inviolable dignity or each person's rights? And can we, it's not simply we just have rights and forget about the general welfare. We want to worry about the general well-being, but we want to go about it by certain means only. Might be another way of putting those pieces together.
And the other problem is that if everyone may have rights to health care, but if we only have this much amount of money to spend, there will be difficult trade-offs.
We need a course.
We have a few more minutes, or we can do another case, or questions. Well, here's one more case we'll do. The daughter of the interviewer is 16 years old. She is adamant that she have a tattoo, and this is causing much friction in the household. What advice would you give the interviewer? Suggestions? Yes?
As a parent, I would never give parenting advice to an interviewer, especially if they are my son either.
Okay, but doctor, this is now one of your patients asking.
Well, there's all sorts of tattoos, so I probably want to know more about the tattoo that she was
Okay. Sure, okay. Yeah.
That's right.
I don't know, it's hard to give advice to the interviewer, but like, if the daughter feels like she can talk to her parents so that she doesn't just go off and get something in some sketchy, dangerous place, it would be helpful, because then maybe she can get advice as to like, what are safe practices, maybe she can get an ear piercing instead, feel better about it.
Right, so that's great. So there's a few points there. Right, so you want to reduce harm. What are the potential harms? Well, she might go to some shady place and, unclean needles. Is there a way to mediate this? Have they talked about it at all? What's happened? Is it, okay? Was there a hand over here somewhere? No? Yes. Oh, go ahead. No, go ahead, Barbara.
I just want to say, just to support just to rephrase, because I think, again, just to strategize, your first comment should probably be along those lines, but more like, I'd want to know more about the relationship this girl has with her parents. I'd want to know, be a little bit less open. Your first couple minutes should be less judgmental and more open, and then you can start to list the harms, or like it could be a sketchy place, or but I think you come across better if you stay a little more non-judgmental in your first minute or two. Otherwise, you sound like you're going for the, tattoo parlors are sketchy, or, whatever it is. Like it's more professional, and you come across better when you stay general initially and then start listing the harms and possibilities more specifically later on in your answer, just as a hint. You had a comment up there.
I think my word would be, first and foremost, is to be open. That would be my suggestion, because you don't want to lose the daughter from the get-go. If you say something like, no, right away, you might go and rebel and get it anyway, like she had mentioned earlier. You might not do it in the best places where they don't keep it safe or clean or whatever. I think being open to the decision and having a conversation, discussion, like you mentioned, depending on the kind of relationship you have with the daughter, and maybe it's a decision that can be made together with the interviewer or the parent and child, as opposed to leaving it to the one person, parents saying no or yes, or the daughter saying no or yes. I think having a discussion, being open about it, not losing her from the beginning is probably the most.
Right. So again, a few things just in terms of principles. So one is communication, finding out what do we want to know more about in this scenario? The relationship, have they talked about it, et cetera. How might we meet, is there a conflict? There's a conflict, right? So how each person has rights here to some degree. How do we mediate it? Well, one might be communication, what kind of communication, et cetera. You would have a hand up, yes.
Oh yeah, I mean, it would be interesting to know what the minimum legal age for a tattoo is, because if she's 16, I think it's 18, then she would be pretty much guaranteed to go to a place that would be a bit under
Right.
the bar in terms of standards anyway. And then also you could bring up, like, she could wear a temporary tattoo at the location
Right.
she wants it,
Right.
and see
Right.
if she likes it.
Right. So again, mediating, rather than yes, no, there's a range of intermediary sort of, I won't say compromises, but solutions, mediations. Yes. Yes. Oh, I'm sorry.
Would it be too much to ask if the point of view of the interviewer, because it is vague as to who the friction is with? Is it with the spouse, or is it with someone else? Because if the interviewer has many tattoos, him or herself, perhaps.
Yes. No, you're right. So the question's a little bit ambiguous. In the household, who is that? So you could ask, if it says conflict or friction, what is the nature of the friction? Is it, the son and the daughter? Is it the wife? Is it, in other words, the interviewers won't answer that question. He's not going to say, oh, no, it's my daughter or something. But you could say, I'd want to know what the nature of the friction in the household is. Is there always friction in the household? Try to get an understanding of that. So that's a great point.
Guy in the back.
Guy in the back, yes.
It's interesting to hear the responses to this question and contradict with some of the responses to other questions. I'm sensing that when it comes to questions that are much more relevant to, or more relatable, like this question, and what you were saying about the question of the vaccine, people seem to be more readily give a response that is actually conclusions, going back to what I was saying, whereas the questions that are kind of less directly relatable, people more consider the options, what are the conflicting values. Do you think that that's a fair approach in terms of how to tackle these types of questions and things that maybe are more personal knowledge about and experience with? We should kind of go the route of actually coming to some sort of conclusion, whereas things that are at a more removed go that kind of.
I would say so first of all, there's very few sort of right or wrong answers, never do this, never do that with these things. I mean, if you're a conclusions kind of guy, that's, maybe you want to give conclusions. I think as a general rule, number one, these answers don't have a clear right answer, one and only one right answer. Two, they're really interested in seeing the process of how you think about it. So I would say that my sense is that what's more important is how you think about it is more important than the conclusion per se. If you want to give a conclusion, fine, but I wouldn't say, she should get it anyway. What's the big deal?
Or she shouldn't.
Or she shouldn't get it. That's it.
I mean,
what else is there to say?
Yeah.
I mean, okay.
There's reasons, like people said, that, it could be dangerous or whatever, or it could be that if you got the tattoo, like that's the thing that's going to help, it's a deal. I'll make a deal. You get straight A's, you can have the tattoo
Right.
sort of thing. I mean, frankly, asking a question about raising a teenager, I agree with your first point, is like, that's so not fair. I mean, you know,
And she's
really?
the mother of how many
and
teenagers?
4. And I have no idea what I'm doing.
She's an
but I
expert.
can't answer that. So
An expert who doesn't know what she's doing.
So I'll take your question one, but just as a reminder, again, we have flyers by the door. Please help yourself, and we have a lot of information online, courses you can take as well, just free stuff. Yes, go ahead.
Just a quick question on the subject of QID that comes to a conclusion, which I understand that for most of these, you know, just the process is very important, but will there ever be a question that's where it's a time-sensitive issue, like a life or death issue, like only one person is going to
You have to
survive,
decide
get
something.
the treatment. In that case,
I've not seen those in the examples, to be honest. I mean, I've read through a bunch of them. Not to say that there isn't, but I was thinking earlier when you all were asking, this is not like a Mission Impossible thing where they're testing you to see whether, like, at the moment you can, like, choose the right, you know, wire to connect or something like that. This I really do think is much more about this reasoning process, moral compass thing. So I'm not saying it couldn't happen, but I haven't seen that.
That would probably involve some medical detail that they're not supposed to presume you'll know the answer. You know, like, well, we better act right away. But I could give you an example. A guy comes in to be examined. He's had a very high fever. He gets himself there to be examined. They say, well, you've got this you've got this, you know, infection, and we can treat it. If we don't treat it, you'll be brain damaged. And he says, no, I don't want to be treated. Well, this is very puzzling because he's the one who came for an examination. So somebody might say, look, if you go with what he's saying, he'll be brain damaged, and you'll never know whether he really meant this or not. If you say, well, he's got a high fever, he's delusional, maybe we have to treat him, and if it really turns out later that he wanted to end his life, he can still do it. As you could say, the best thing to do is to assume, because of the unusual circumstance, he came on his own, but he's got a high fever, and he's clearly in bad shape. He doesn't exactly know what he's saying, or he doesn't mean what he's saying, or what he's saying isn't consistent with his being there in the first place. So let's treat him now, and the worst scenario there is not as bad. Namely, he said, we shouldn't have treated me. I wanted to die. Well, we're very sorry. That's the best we could do. Now please go and do it. Versus if we had not treated him, he'd be dead, and we'd never know.
Right.
So there are cases like that, but I doubt that they're going to ask you about it.
And Arthur's giving you a great, though, answer, right? Because he said we could do this or that, and is giving you the sort of moral underpinnings of both answers. And this is why I would choose this one. And I think that's all fair. My values say I would choose this one, but I can tell you, either choice what the value or moral underpinnings are.
And there is something, when it's so uncertain, you could say this is what's called mini-max regret. You try to do the thing that if things turn out not as well as you expected, your regret is less than it would have been if you had done the other. I mean, there are ways of thinking about this, but I don't think they're testing you on game theory, whether you know about how to make decisions under radical uncertainty. I would say about this that this is an unusual case. It's not within biomedical ethics as such, right? It's sort of general human relations ethics. And so you might first say, gee, I don't know that I would have to project my opinion. But if the person's really insisting, and then you go and show a lot of empathy. Now, why does this young woman want to have this? If it could be temporary, would that satisfy her? Because there's a real question about whether she'll regret it herself when she's a few years older. Yeah. Why the hell did I put Bob's name here? I hate that guy now. Why did I get my So I mean, that's a legitimate thing for a parent of a minor to be concerned about. I don't really approve of it anyway, but I'm not sure you'll approve of it later. You're not, you haven't had that much experience. You could try to work it out in human relations terms and say, but on the whole, I mean, I hope I'm not asked too many of these very personal questions. This might be a legitimate question for a would-be pediatrician who wants to specialize with adolescents.
But these are real questions you all may get. But I think
for older kids.
I think coming back just to the question of, why does each person in the scenario want what they want? To understand the question, understand why are they saying they want what they want, that opens up a lot of grounds, and it will be things that you'll probably need to know for most cases. Again, one can't generalize for all the possible cases. My sense is that I've been asked to be on to help develop questions for the boards, and they want to see your thinking, and these are questions that you can't answer with a multiple choice answer. It's really to get you to try to think that's what they're interested in. Anyway, unfortunately, we're out of time, but if you're interested, we'll be around, and I'd be happy to talk to you more further. We have flyers there. Again, thank you very much, and good luck to you all.
Thank you.
Hey, Bob,